Welcome to the Deep Dive. Today we're jumping into a topic that affects millions of women. Specifically, how you can use simple blood tests right here in the UK to confirm menopause. And we're going to focus on why getting that diagnosis early is so important. All of our insights today are pulled from experts in the field, including the great information available at Blood Test UK.
That's right. And our goal today for you listening is really to cut through some of that confusion, to understand three key stages. That's perimenopause, menopause, and then postmenopause. And, just as a reminder, the official definition of menopause in the UK is 12 straight months without a single period, typically hitting between 45 and 55.
Okay, so let's start at the beginning of that journey, the symptoms. We hear about them all the time: hot flashes, night sweats, mood swings. They affect about, 3/4 of women?
Yeah, about 75%. And those irregular periods, of course. When those things start to really disrupt your daily life, the NHS advice is clear.
Go see your GP.
Exactly. They'll do a proper assessment and look at your whole history.
But I have to ask the question I think a lot of people have. If the symptoms are so obvious, the sweating, the mood changes, why bother with a blood test?
That's a great question, and it's a fair one. For many women over 45, the symptoms alone are often enough for a diagnosis. But the testing does two really crucial things. First, it helps rule out other conditions.
Like a thyroid issue or something.
Precisely. Things that can feel very similar. But more importantly, the blood test gives you objective data, a baseline. It shifts the conversation from, I feel this way, to here is exactly what's happening inside your body.
Okay, so let's dig into that data. The stuff confirmed by health experts. When a GP recommends a test, they're looking for two main things, with a third for context.
That's right. The first one, and it's the big one, is FSH, that's follicle-stimulating hormone.
And the simple way to think about this is, your ovaries are slowing down their production of estrogen. So your body's control center, the pituitary gland, starts to, panic a little.
It's a perfect analogy. It senses that estrogen is dropping, so it starts to shout louder to try and wake the ovaries up. It sends out more and more FSH.
So because the ovaries aren't listening, that FSH level goes up.
Way up. A level that's generally over 30 MIUML is a very strong sign that you're in that menopausal transition.
And on the flip side of that, you have oestrogen.
Exactly. That's the main type of estrogen the ovaries are supposed to be making. So as the ovaries slow down, the oestradiol level goes
down. A significant drop.
It's that classic inverse relationship. FSH up, oestradiol down. That's the chemical fingerprint we're looking for. And we also often check LH, luteinizing hormone, just to get that complete, comprehensive picture. It's the standard, accurate protocol here in the UK.
Okay, so that's the science. Now let's talk about the benefits. This is the really powerful part. Knowing early isn't just about confirming that your periods have stopped. It's about improving your quality of life right now.
Oh, absolutely. The most immediate benefit is getting access to the right treatments to manage symptoms. Things like hormone replacement therapy or HRT. But it's the long-term benefits that are even more critical.
What do you mean?
Well, estrogen does a lot more than manage periods. It's protective for your bones. When it drops, you can get accelerated bone density loss.
Which is osteoporosis, the risk of fracture.
The massive risk. We're talking about your actual structural integrity for decades to come. It's not just about comfort.
That's huge.
It is. And it's also linked to changes in your cardiovascular health, your heart. So getting that early diagnosis, backed by test results, lets you be proactive. You can start making lifestyle changes, like with diet and exercise, as recommended by the UK's NICE guidelines. You can manage these future health risks before they become a real problem.
That proactive approach really seems to be the key.
It is.
So recognizing those symptoms and then getting the hard data from those three simple tests, FSH, oestradiol, and LH, is what lets you go from just enduring this to having a real health strategy.
Yes. Summarize, menopause is just a biological process, of course. But when symptoms start affecting your life, knowing your hormone levels lets you ask your doctor the right questions and take control of your health journey.
So our final thought is this. Menopause is a transition, yes, but you don't have to just write it out. Knowing your numbers, which you can find out about through resources like Blood Test UK, gives you the power to manage it. You can move from feeling overwhelmed to having a proactive, personalized care plan that protects your bones and your heart for the future.